probably if we think about defining it, we're all healthcare providers, so we can think about what recommendations should we have. One, of course, is Hep B vaccination. And I think those who are going through school, through pharmacy school, med school, nursing school, in the last, say, 15 years, maybe even 20 years now, would have already gotten their hepatitis B vaccination. Different schools integrated it at different times. Those who have been in practice longer may need to go back and get their hepatitis B series if they come in contact with blood. So if pharmacy-based immunization is widespread across the nation, which it is, and that's become part of the job, and our national boards test on it, and it's probably going to become an expected graduation requirement that people know how to vaccinate, then all pharmacists should have had hepatitis B vaccination. They need influenza every year. They need to get a Tdap vaccination if they haven't had a Tdap already. So those are some of the core vaccines for healthcare providers. I think the other group that we think about are pregnant patients. So obviously with Zika virus, people are paying attention to pregnant patients, but what we don't want is the conversation to go to a very rare condition that occurs maybe from a virus, but focus in on the things we know are related to pregnancy and that we can prevent. So the first is Tdap during pregnancy. And it's very important that the Tdap vaccination be administered every pregnancy and in the 3rd trimester. What we're trying to do is maximize the antibody protection of mom passing on to the newborn, because we know that almost all of the deaths occur in kids less than 1 year of age. And in fact, if you even go down smaller, down to the 3-month age, that's where we see the bulk of cases. Too young to even complete an immunization series. So vaccinating mom is probably going to be our most important strategy to protecting infants from pertussis. And then the other vaccine, of course, is influenza. Influenza in pregnancy, it started out not in the 1st trimester, avoid the 1st trimester, and now it's all trimesters. So just to make it easy, influenza vaccine is safe and effective in pregnant women. So those 2 vaccines, I think, are a high priority for pharmacists to get in.